Hi, so you're probably watching this video because we have decided to go forward with a prostate biopsy. Again, what that would be is a transrectal biopsy. We use an ultrasound that's inserted transrectal, and we take either 12 or maybe 14 cores of prostate tissue, something like that. The process takes about 10 minutes. Generally, it's done here in the office. We can give you a Valium or something like that if you'd like. You would need a ride to and from. Generally, it's a well-tolerated procedure. I do use a numbing injection to help with the discomfort. But so first, for like pre-biopsy instructions, I do recommend that you do a Fleets enema the morning of the biopsy. So go ahead and head to the store. Those are over the counter. Just grab a Fleets enema. If you need a prescription, I can certainly prescribe that for you. But generally, it's cheaper over the counter. So one Fleets enema. And then if you are on any blood thinners, then I would recommend stopping those blood thinners. If you're on Coumadin, it's going to need to be 5 days. I think Eliquis and those blood thinners that you don't need an INR check can be 3 days. Aspirin, generally, we recommend holding for 5 days. And if the cardiologist, if you have a cardiologist and they provide alternate recommendations, I'm fine working with generally all of the cardiology recommendations. There may be a slight increase of bleeding, but again, it is pretty rare to be admitted to the hospital for bleeding after this procedure. The risk of actually being admitted is probably less than 1 in 500 or something like that. The risk of infection, again, is about 1%. When they do happen, though, they are significant. So if you start having fevers over 101 degrees after the biopsy, you can just go straight to the emergency room, and they will, tell them you had a biopsy, and then you're having fevers, and then we'll get you started on antibiotics right away and call me, and we'll get that sorted out. But again, that's a low risk. That is basically all I have. Oh, the other thing to know is if you're on supplements, we generally recommend you stop the supplements 48 hours before, and like fish oils, vitamin E, and stuff like that. And then if you're taking like ibuprofen or any NSAID like that, Mobic, Aleve, I would recommend stopping that 48 hours prior to the biopsy. The other thing to know that I would really like everybody to know: have breakfast, please. It sometimes after this procedure, people get, we call it vasovagal. And what that means is that it kind of causes an internal reaction where people like, when people pass out when they see blood and stuff, that's kind of their reaction. And so it can be kind of like a thing where for a couple minutes we're like trying to wake somebody up. And that happens maybe once every 20 or 30 biopsies, I would guess. It almost never happens if the patient had breakfast. So, and there's no need not to have breakfast. So go ahead and have breakfast, have a nice breakfast before you come, and that will be helpful. And that's it. Have a great day.